Hi guys, I wanted to briefly jump in here to talk about this very cool, interesting case for a couple of reasons. Number one, to showcase the power of diagnostic musculoskeletal ultrasound, but also to showcase how important is this collaboration between specialties. This was a particular case that was sent to me by one of our hand surgeon colleagues for a diagnostic ultrasound of the flexor tendons. This is a patient that was originally admitted to the hospital with a foot infection that unfortunately got complicated with an infection that developed into the bone called osteomyelitis that needed multiple surgical debridement and a prolonged hospitalization with IV antibiotics. Well, once he leaves the hospital, he notices that he's unable to flex one of the fingers of the hand and concerned for a flexor tendon tear. Well, unfortunately, when someone has a flexor tendon tear and is complete, and we suspect it might be complete, the only way to truly fix it is a surgical intervention. We have to repair the tendon. The problem is that sometimes we are not sure where the tendon tear had happened. Could it be at the tip? Could it be more on the palm? Could it be more at the muscle level? So that's where your ultrasound comes in as a diagnostic modality, that it allows us to identify exactly where the tear is, so we do not have to open the hand and be able to have a more direct approach. Now, this is never 100%, but we always want to get as much information so we make the procedure more efficient. So in this next video, you're going to see how we are able to accurately diagnose and localize that portion of where the tear happened. And then we're going to see the post-surgical or the surgical pictures that can correlate to where the tear happened, making the surgical repair smoother and ultimately have a better patient outcome. Hope you enjoy the video.
When I'm able to get good tendon tissue there, and when I flex it, I see good tissue. So now I want you to kind of keep an eye on it. I'm going to start to scan proximally now. Right there, you start to see the division of both tendons, 1 and 2 here. At this point, if I still flex it a little bit, we are able to see some motion. Keep an eye on here. And at this point, now I'm down here. You know, there's a lot of anisotrophy at this point. But here, keep an eye on here. It's going to go away. I'm going back now. I just moved proximally. I'm going to find it again. And here, it went away. So if you look where I'm at, Doc, look at my hand now. So I'm exactly, this is the lunate here. So I'm right proximal to the carpal tunnel. Now there's a lot of inflammation, and even when I scan up, I don't see the tendon anymore. But there's a lot of swelling here. So there might be some bulging of the muscle level. But essentially the distal stump is going to be here. Here it came back. Again, I'm going to now scan proximally, and it goes away. Back and forth, you can see it there. And even once I come here, I am able to flex it, and I still see some motion. Obviously, once I get past the tear, there it went away. There's no more movement of the muscle. So, come back here. So, and I made some marks here. Essentially, it's right at the level of the proximal to the carpal tunnel, right at the level of the lunate, where I'm able to see that disconnect, at least of the flexor tendon. Thank you for stopping now.